Assalamualaikum and good morning. My name is Abharina Aiman. Today, I would like to present my final year project on the title A Description of Six Sigma Application in the Healthcare Industry. Introduction. Healthcare is considered to be an important determinant for the promotion of the physical and mental welfare of individuals worldwide. A good working healthcare system needs financial facilities, a well-trained and a well-paid staff, sound policy and decision-making intelligence, and well-administered clinical facilities. Quality health services are required for improvement in health protection, disease prevention and management, reduction of unnecessary handicap and premature death, and also health equality for all. Next problem statement. My first problem statement is healthcare overwhelmed by efficiency, mistakes, restriction on resources. Second, delays in the implementation of reliable, efficient health treatment. And third, medical errors and variability are affected. Next is research objective. To identify the methodology in the Six Sigma should be used to minimize the problem in the healthcare industry. To analyze the relationship between the process of Six Sigma and the healthcare industry. And third, to investigate the most important of Six Sigma in the healthcare industry. Then we move to research framework. My dependent variable is the healthcare industry, and I have 5 independent variables, which is H1, reduce waiting times before operation, H2, reduce unnecessary laboratory testing, H3, reduce overtime of hospitalization, H4, improve diagnostic imaging, and H5, reduce contaminate needle sticks. Questionnaire design. As for my questionnaire, I have 3 sections. The first one is section A, which is demographic profile. Section B, which is positive effects when using Six Sigma methodology to minimize problems in the healthcare industry. And section C, acceptance of the Six Sigma methodology process in the healthcare industry. As for data analysis method, I already used 4 methods, which is restrictive statistics, Pearson correlation coefficient, reliability analysis, and multiple regression analysis (MRA). Next is demographic profile. The first one is age. My respondent come from 26 to 33 years old, which is 100, and 83 or 50.7%. Second is gender. Between female and male, the female is the highest one, which is 229% or 63.4%. Third is education level, which is diploma, 219 or 60.7%. Fourth is job position, which is come from nurses, which is 207 or 57.3%. Then duration of work experiences come from 6 to 10 years old, which is 205 or 56.8%. Data analysis and discussion. Descriptive statistics for dependent variable and independent variable. As you can see, for descriptive statistics independent variable, all the mean value is above 4.8, and as for standard deviation is above 0.3. As for descriptive statistics dependent variable, the value mean is above 4.8 and the standard deviation is above 0.3. The respondent had agreed that reduced waiting times before operation, reduced unnecessary laboratory testing, reduced overtime of hospitalization, improved diagnostic imaging, and reduced contaminated needle sticks had influenced the healthcare industry. Next is pilot test. Cronbach alpha value is 0.982, which is there is a strong reliability and the questionnaire was reliable. As for validity test, which is Pearson correlation coefficient, the Pearson correlation for all independent variables is above 0.8, which is there is a strong relationship between all independent variables and dependent variables. We'll move to hypothesis testing, multiple regression analysis. As for ANOVA table, F value is 267.638. Significant value is 0.000, which is P less than 0.05. The independent variable statistically significantly predict to the dependent variable. As for model summary table, R value is 0.889, which is strong relation between the variables. As for R square value is 0.709, which is 79% was affected by waiting time, laboratory testing, overtime hospitalization, diagnostic imaging, and needle stick. Another 21% was affected by other factors. Discussion on research objective 1. To identify the methodology in Six Sigma should be used to minimize the problem in the healthcare industry. All the independent variables were included: reduced waiting times before operation, reduced unnecessary laboratory testing, reduced overtime of hospitalization, improved diagnostic imaging, and reduced contaminated needle sticks were seen as the most determinant from the previous research. In this case, the researcher was a success to list out all the Six Sigma methods that use the healthcare industry to achieve the positive effect when using the Six Sigma methodology to minimize the problem in the healthcare industry. Then, discussion on research objectives 2. To analyze the relationship between the process of Six Sigma and the healthcare industry. As for independent one, which is reduced waiting times before operation, the sigma value is 0.294, which is more than 0.05. So the result is rejected. Aside from that, using Six Sigma in the healthcare business for the time-saving management is sometimes difficult, since it is difficult to establish a process that can be quantified in terms of defect or mistake per million change. Next is reduce unnecessary laboratory testing. The sigma value is 0.010, which is less than 0.05, so the result is accepted. According to Conroe 2021, Sigma finally gave them an initiative that was led by critical care trainees and staff with significant buy-in. It is likely that individual practice patterns began to change even before the formally structured rollout of intervention in reduced unnecessary laboratory testing. Next is reduce overtime of hospitalization. The sigma value is 0.01081, which is more than 0.05, so the result is rejected. According to Robinson 2014, the hospitality industry that use Six Sigma approach is not just affected by unorganized operations, longer lengths for stay for patients inside the emergency room, and a stressful environment. Okay, next, improve diagnostic imaging. The value of sigma is 0.000, which is less than 0.05. So the result is accepted. Six sigma is already used in diagnostic imaging because focus on optimizing time, people, and equipment resources and improving service delivery for patients, employees, radiologists, and referring physicians while lowering costs and increasing income. The last one independent variable, which is reduced contaminant needle stick. The value sigma is 0.000, which is less than 0.05. So the result is accepted. In 2014, Broward Health Primary Group Care Environment (EOC) stated a healthcare system to reduce contaminant needle stick using Six Sigma had been used successfully implemented by their health instruction. Discussion on Research Objective 3 to investigate the most important of Six Sigma in the healthcare industry. Six Sigma helps to improve patient safety and satisfaction. In other words, Six Sigma aims to teach healthcare management how to manage procedures. This includes registering patients, filing claims, surgeries, and transplants, each of which require a special set of producers. Six Sigma, as for medical error and care deficit frequently inhibit efficiency and safety in the healthcare. On the other hand, implementing Six Sigma in the healthcare will help reduce all of these to a bare minimum. Six Sigma also can be used in areas of healthcare other than increasing patient satisfaction, reduce medical errors such as reducing diagnostic laboratory errors, and conducting capabilities studies and improving various medical and surgical procedures. Then implication of the study. New recruitment of healthcare workers need to speak with the dissemination of information concerning the causes of contaminated needle stick, including training and awareness. Six Sigma is used to improve patient, workers, radiologists, physician referral and cost reduction, as well as improvement of revenues in this instance in the diagnostic imaging industry. Six Sigma was helping a clinical laboratory primary task to improve clinical outcome by delivering precise results in time so that they will not have a complaint delay results so long after the patient gets tested. Six Sigma in the healthcare business for time-saving management is sometimes difficult since it is to establish a process that can be quantified in terms of defect or mistake per million chances. An overtime scenario not only frustrates patients and their families but also causes administration deficit in incoming patients. Limitation of study. There is three limitations of study. The first one is time constraint. The researcher had a limited time, which was 3 month period to collect the data from the respondent. In this case, the researcher only has a limited time, which is from October 2021 to December 2021 to send the questionnaire to the respondent. Second, target population. The target population also is one of limitation to conducting this research. This is because the target population response for the survey only focused on healthcare workers in Malacca. Then, some of them did not want to give their corporate when the researcher asked them to answer the questionnaire. Third, knowledge of Six Sigma. Some healthcare workers did not know about Six Sigma that had been used in their industry, so they cannot answer the questionnaire correctly. 10 recommendations for future researchers. I suggest they should be approach the healthcare workers properly at a suitable time and use a qualitative method for conducting the further study to get more understanding of the user perspective. As for the conclusion, Six Sigma has been proved to have a major influence on healthcare administration, operation, and direct patient care, resulting in cost reduction as well as quality improvement. Six Sigma may be applied to eliminate mistakes across the whole healthcare services chain. Six Sigma has been used to minimize physical error, patient wait time, supply chain stage and cost, boost stronger financial flow, and reduce the time each takes laboratory to provide data. Six Sigma approaches are crucial in healthcare because they might be eliminate defaults that might lead to medical errors. This is my last slide for my presentation today. I am Nur Abharina Aiman. Thank you for lending me your ears. Thank you for watching.